Top 5 ways poor circulation in legs and feet reveal heart trouble. Do you call that right now? Your feet could be sending signals to pay attention to your heart? When you think about cardiovascular health, your feet are probably not the first thing that springs to mind. But even though they could be further from your heart, your feet can alert you to cardiac issues. So make sure to watch this video till the end to discover 5 surprising ways poor blood circulation in your legs and feet can reveal heart trouble. Also stick around for a special gift that will help you clean out your arteries and significantly lower blood flow risks. Number 5. Change in hair growth. When was the last time you paid attention to the hair on your toes? Just like the hair on your head can tell you if you're malnourished, the hair on your feet can tell you how your overall circulation is doing. If you've always had hairier toes, and then suddenly notice thinning or complete loss of hair on the toes, you may want to see your doctor. Hair on the toes, especially your big toe, is completely normal and actually is a sign of good blood flow to your feet. If suddenly you notice you haven't shaved your toes as frequently as before, then you need to pay attention. Loss of hair on your feet and toes may be a warning sign of poor circulation. This can be due to decreased blood flow in the smaller vessels in your feet. Decreased circulation in your toes and feet may indicate vascular disease or atherosclerosis, or it could be a sign that your heart isn't pumping as efficiently as it used to. Either way, hairless toes could be a signal that your heart is in trouble. Number 4. Swelling in your feet. Swollen feet and ankles is a condition that many seniors have and ignore. This is a big mistake. If you sit down, remove your socks and shoes, and it looks like the narrow band of the sock is still there, then something's not right. Or if you reach down and push down on your foot, ankle, or lower shin bone, and when you take your finger away, your finger depression is still there, that's abnormal. And if you experience constant aching and discomfort in your feet even when you've tried everything, normal exercise, drink enough water, and wear supportive shoes, this problem isn't just annoying, it's also potentially dangerous. These symptoms point to circulation issues causing blood and fluid to pool in the tissue around your feet and ankles, and could result in serious clots or devastating cardiac events. Swelling or edema in your feet and ankles could be caused by a number of things. It could mean that your heart isn't circulating blood properly, there's a vein blockage in your leg, or that you're suffering from congestive heart failure, CHF, liver cirrhosis, or kidney disease. Swollen legs can also be caused by deep vein thrombosis, DVT, a condition in which clots form in the blood vessels drain blood from the legs. Another likely cause of swelling is chronic venous insufficiency, CVI, a disease in which blood does not properly drain from the legs. People with venous insufficiency suffer from severe swelling at the end of the day. This condition can be eased by raising the legs up against the wall for 20 minutes, 1 to 3 times a day, doing seated chair exercises, or wearing compression socks. Number 3. Cold feet. Are your feet and hands always freezing? Do you live in fuzzy, comfortable socks? Do your legs feel persistently heavy, and do you experience painful cramps when you walk? If you answered yes to any of these, it may be time for a doctor's visit. Reduced circulation in the extremities and nerve damage owing to atherosclerosis are 2 of the most common issues that cause cold feet. In atherosclerosis, arteries are narrowed by fatty deposits known as plaque that impede blood flow in the limbs. This is a chronic condition known as peripheral artery disease, or PAD, which is one type of peripheral vascular disease. PAD becomes more common as a person gets older, and by the age of 65, about 12 to 20% of the population have it. People with PAD have 4 to 5 times the risk of a heart attack or stroke. Since your feet are the farthest body part away from your heart, they are often the first to show signs of poor blood circulation. Number 2. Blue feet or toes. Just like cold feet may be a sign of poor circulation, so can blue or purple toenails. If you have a bluish tint to your toes or feet that is not caused by a recent injury, this can indicate cyanosis. This condition occurs when your blood isn't carrying enough oxygen to your muscles, organs, and other tissues. Cyanosis can point to several serious issues such as chronic obstructive pulmonary disease, COPD, pulmonary hypertension, a complication of COPD, and congestive heart failure, CHF. If you notice your toes turn blue and you have difficulty breathing, seek treatment immediately. Number 1. Burning pain. Burning pain, tingling, and numbness in your feet may be a sign of nerve damage. Nerve damage may be caused by PAD, swelling in your feet, or peripheral neuropathy because of diabetes. This condition can be tough to live and cause a lot of distress. It isn't something to be taken lightly. Burning pain should always be checked out because you may also have areas of your feet that become numb without your knowledge. This can lead to foot ulcers and wounds that are difficult to heal. To get a list of nutrients that help reverse neuropathy, see our video, 11 Best Vitamins for Your Nerves. There you have it, the 5 signs of poor circulation in your legs and feet that your heart is in trouble. You already know that avoiding tobacco, eating a balanced diet, and staying active are things you can do to keep your heat healthy. Now add monitoring your legs and feet to the list. Are you concerned about poor blood circulation and heart health? Do you want to know how you can protect your heart and prevent heart attack and a stroke? Join the conversation in the comments below as we share our experiences and tips for healthy happiness. If you found this video helpful, don't forget to give a big thumbs up and subscribe for more refreshing content like this. You'll be healthy. Check out the next video.